Hello everybody, Suzanne Kellner-Zinck with Dawning Visions Hypnosis, speaking about males with eating disorders. And in this video I want to talk about some of the comorbidities, meaning other illnesses, mental health illnesses that can come together with the eating disorders themselves, because this is really the majority of cases, to tell you the truth. First, let us recognize that the fact that someone who has an eating disorder is dealing with a lot of anxiety. They have a lot of negative thoughts going on in their heads in terms of how worthless they are, a lot of self-loathing thoughts. And to kind of keep these at bay, they create these obsessive compulsive behaviors, which are the eating disorders and all the things attached to the eating disorders, such as overexercising, self-harm in different ways. With men, it's more about anabolic steroids because they're trying to build muscle mass. With women, it's more about self-harm with cutting themselves, so they actually know they exist and they feel calm as a result of doing this behavior. So obsessive compulsive behaviors are a form of anxiety right there. Now, when people figure out that the thing that they did to make them feel safe, and the one thing that they control, which was how much food, when they were going to eat, how they were going to eat it, and where they were going to eat it, as well as being able to work out as much as they chose, there comes a point when they feel really depressed because they know they lost the control of what was going on in their mind and their body. And at some point, some of them, not all of them, some of them recognize the fact that they are in deep trouble, emotionally speaking, and they'll reach out for help, even though there's a lot of stigma attached to eating disorders in males because it's seen as a female disorder, which is ridiculous because there's 10 million men in the USA alone that are suffering with male eating disorders, anorexia and bulimia. So this is a real issue, and it is a crisis because we also know that 1/3 of all men who have eating disorders and are not able to get it under control, they're not able to overcome it, they will commit suicide. Men tend to use much stronger ways of doing this than females. They will use a gun or they will hang themselves. Whereas women are more likely to use pills, which a lot of times will end them in the emergency room and they'll have to take some charcoal or whatever in order to get it out of their system, or they'll make superficial cuts on their arms and legs. So you can tell that this is a really, really huge problem when we're looking at the overall progression of the illness. And it is a progressive illness. You know, it starts pretty innocently with maybe wanting to drop some weight and then build some muscle, and then it gets to the point where the muscle dysphoria is such that they can't even see the muscles that they're building, similar to a woman who's looking in a mirror, who's down to a skeleton of what she used to be and can only see how fat she is. So we need to do some real work around why these things are happening and why they actually develop the illness in the first place. Because if you don't understand why they developed the illness in the first place, you're not going to be able to help them reverse it. I'd also like to bring out the fact that most of these things are living in the subconscious, unconscious mind. So when the conventional therapists are trying to use conventional ways of treating it, they're not going to get very far in most cases. In fact, most treatment centers are only about 5% effective, which makes them 95% failures, even with the 24-hour care that's involved. And that's something that we need to take under consideration when we're looking at where the treatment needs to happen. The other problem with the whole treatment facility, even if it's not patient group, is that eating disorder people are into perfectionism, so they're going to do whatever they can do to reach their goal. So for men, it's going to be working out a lot more, and if they're not getting the nutrition that they need in order to build the muscle mass, they're going to make themselves really sick. And some can die from heart attacks from overexertion. This happens with the female side as well, when again they're exercising too hard and their body doesn't have what it needs in order to do the work. As well as degrading the immune system, because if you don't have the appropriate nutrition to do what you're trying to do, obviously infections are going to be more likely to take hold. And that's another way that a lot of people that is eating disorders end up dying, quite frankly. So we need to understand that there's a multitude of issues that we're dealing with here, aside from just the eating disorder, which is a physiological as well as an emotional problem. We're dealing with depression and anxiety disorders as well. So it's complicated, but it doesn't mean that it can't be healed. It can be healed if you have a person who actually understands how to do the healing and is willing to work with you where it matters in the subconscious, unconscious mind, and someone who will hold you accountable to do what you need to do in order to do the healing work. And actually, that's one of the things that my bulimic and anorexic clients told me. They said, so often they go see their psychiatrist or psychologist, and they were never held accountable for anything. They didn't even know what the hell they were doing in there, actually, meaning the therapist person. Whereas I gave them homework, and they couldn't move on to the next step of the healing till that homework was done, because the homework was necessary for us to know what to do in the next step. And that's the way it goes. And there's a lot of different things that need to be handled when we're dealing with eating disorders, depression, and anxiety disorders. But there is a method to the manner in which I do the treatment. You do it from the comfort of your own home. You do it in a time schedule that works for you. And it's $10,000 for up to a year's services. And generally, my eating disorder people only need about 6 months. So it's double the amount of time you'll probably need to know that you're actually done with it. And the really great thing that I can tell you is that, at least with my clients, I've only had one who didn't succeed. And she was older. Most of my other clients were in their early 20s up to 29 years old, and they all succeeded with flying colors. The 40-year-old had so many other issues above and beyond the depression and the anxiety disorders. She just was a total mess, and there was just a lot of family dynamics that were just not helping her. There were issues with being manipulated by the church that she was a member of, and a whole bunch of other stuff going on with her at the time, which made it really, really difficult to help her heal in the way that I would have loved to have seen her. And it wasn't due to my not giving her time, trust me on that. However, it was what it was. But for all the rest of them, they don't even look at it anymore. It's not in their life. It's gone. They've moved on to much more important things in terms of their careers, in terms of having really healthy relationships, first with themselves and other people. It's really quite a beautiful thing to see even all these years later with some of the people that I'm still involved with. Not because they need my services for that per se, but I had one who was a videographer, and she needed some help with how to go about finding time to do her own videography as she was being mentored by another videographer who didn't seem to understand that she needed time off. Things of that nature sometimes come up. And sometimes they just check in with me to let me know how they're doing, which I always appreciate. Because I'm a human being dealing with human beings, people, all right? I actually care about how my clients are doing. I love being updated on where they're going, and if they need help with other areas, of course, I'm here to help them in those other areas. And actually, to tell you the honest truth, none of them have fallen back. None of them. None of the ones who have succeeded have had any fallback problems. So if you actually listen to the clients, learn from what works for them, work in the unconscious mind, deal with the addiction the process of their brain in order to actually stop the addictive behavior, which is the obsessive compulsive thoughts and behaviors, then guess what? You can have really, really great results along with the accountability. And trust me, I don't like doing the accountability, but without the accountability, there's no reason to come see me, quite frankly, even with all the other things that I have to offer, including the psychiatric end of it, the medical end of it, the hypnotic end of it, being able to help you to actually have suggestions to help you eat appropriate meals and to exercise at a reasonable and healthy rate, and to be able to do what you need to do in order to build up your muscle in a safe manner. So that's all I have for you for today's video. As always, I thank you for spending your time with me. Until next time, and have yourself a great day. Be well. Bye-bye all.